This is one of our patients, Dustin, and I started working with Dustin a while ago. And when we originally started, we were working on some hip issues that he had from being an athlete all his life, doing competitive exercise. As an athlete, he developed also some neck tightness and worked at a desk, had a busy life, father of 2 young boys, so super active as well, wanted to spend time with his kids playing and doing the activities that he wanted to do. But some of the things that really were bothering him was sitting in a car for a while, sitting at his desk for a while, playing with his kids on the ground. So there were life limitations as well as discomforts and pains. The first thing that I do when Dustin comes into the office and is here for a treatment is we just do an assessment to see how the body is moving. So part of that is a seated assessment where the patient and Dustin just sits and I see how the whole spine is moving. By gently creating some motion, I can feel whether the joints are moving correctly and where the muscular tension is throughout his spine, and it tells me some feedback about his hips and his shoulders as well. Do the same thing into the neck, feeling where there's restriction, where there should be movement and not, and where there's tension in his body and in his muscular system, where there should be ease. So that's one way that I assess a patient when they first come in. And the second way, I'm just going to lay face down, is here on the table. Another way that I assess what's happening with the patient and what I need to do for the day is also to come down when he's laying face down on the table and just look at how his breathing is. I'm trying to see it, can he do a deep breath into his diaphragm, or is his shoulders just rising up and doing more of a neck breathing? Because that can cause issues on its own. Then I start to look and see, is one side raised and another side flat, or are there any type of imbalances that he may not even know about? So looking first to see there, and then I check a little bit of how the whole body flows as a unit. Just by giving a little bit of gentle pull on one side, I can see, does it flow all the way up the body? How does it compare to the other side? And that gives me feedback about where his body may be very fluid and open and healthy, and where other areas may be restricted and there isn't motion and movement and stress. I come up forward to see how his hips are moving, how his whole back is moving, and again, feeling through where some of those tension spots may be. One of the things I found during that initial assessment and exam is that he has some restriction in his right hip, and it doesn't move as easily as his left hip does. So I want to figure out why. And what we're going to do is test some of the muscular strength. So Dustin, just keeping this leg straight, raise it up off the table as high as it goes. And then we're going to do the other side. Go ahead and raise the left. Goes much higher and actually matches exactly what we found, that it was restricted. So that tells me that some of the muscles in the hip, and I go through my Rolodex in my mind of anatomy to know what actually causes that leg to rise, what muscles are involved, what joints are involved, and that gives me the signal of where to go to start doing the work that I have to do for the day. One of the techniques and things that I use to help bring more pliability and flexibility to the muscle system is called active release technique. Here, that's what I'm doing to the glute muscle. So Dustin said that for him, sitting down for a long period of time was really bothersome into his lower back. And often it's the actual muscles in the hip and the glutes, your butt, that are restricted, so it makes you feel pain in your back. And that's what Dustin's experienced. So this is a technique to get flexibility and pliability back into that hip so that it can get pressure off of his lower back. So we do a couple of repetitions here, and it's not a massage, it's therapeutic. Not just to feel good, but to make a difference. Not to just feel better, but to actually be better. Because that's what we're trying to do. Not just give you pain or symptom relief, but to actually go to where the real issue is and make a physiologic change. To actually literally change your body. That's what these maneuvers do. Now there's some other muscles that are involved here, so I changed the technique. It's still active release technique, but I'm just doing a different movement to target a different muscle. Justin will tell you, it feels not painful, but it almost like he knows he needs it. While I'm doing this, I'm listening. I'm not forcing some position or movement. I'm listening and feeling with my own hand, how much pressure should I give? Does his body fight back? Does he resist? I'm listening to how his body is taking in this treatment, and I modify what I need to do based off of how receptive his body is. So if it's the first couple of treatments, we're going to start slowly. We're not going to be putting a lot of pressure. We don't need a lot of pressure to make a good change. And it also doesn't need a ton of time and repetitions. This is very effective treatment when done correctly. We started to get into the two different muscles in the lower back. And now we start to identify if there's anything else I need to do. I also know that he's got some neck tension and stiffness, and that's been a problem for him in his work. If he needs to change directions, look at different monitors. So we transition up along the spine, and I'm just going to feel through the tension. Where I feel here is very different than the other side and areas above and below it. And that tells me something specific. I've developed the ability to feel what actual anatomy piece that I'm touching, if it's a bone, if it's a muscle, if it's something else. Now we're going to start to get into some of the adjustments that are going to start to create movement and take tension off of the joints in the spine, which affect the nervous system. Right here is where I feel a restriction, and the adjustment is just a gentle pressure into the body, waiting for the right moment when Dustin's body is relaxed and able to take that adjustment in, integrate it, and make a change into his nervous system. And that's what we're going to do here. It was already moving easily right before I actually made that adjustment, made that little release. I'm going to assess back into the hip, and we found again that this side was restricted with those glute muscles and piriformis. So that's where we're going to make an adjustment into his lower back. Dustin's in the position that we're going to adjust his lower back and hip in. One of the things that's really important for me is that I have the patient in a position of relaxation. I don't want them to feel like they're being twisted or feel stressed when they're about to get an adjustment, because it's not going to be a good outcome from that adjustment. The body needs to be in a position where it feels comfortable and relaxed, at ease, so that when I actually make an adjustment, the body is open to that and can work it into its system and then make a change. So that's what we're going to do now. We're going to set his body up into the right position. Nice and easy, rolling towards me. There we go. I had to use a little more effort for Dustin, who's got a little bit more musculature, a little more tension in his body. So everybody's a little bit different of how much effort or movement I have to use my body onto. The next adjustment we do for Dustin is right at the base of the neck and top of the shoulders. It's where kind of a really big junction point. It's where you can think of a highway kind of coming together and merging. Very important for our bodies, kind of where that tech neck and upper back hump happens to some people. We really want to keep that mobile and moving, and so that all the nerves that are there can go out and do their jobs. This is the way we adjust that upper area. Now Dustin just takes a breath of air in and out. He's easy and relaxed. He just feels a gentle little amount of tension. The last piece for Dustin is his upper neck. There's some tension and tightness there. We're going to do some active release technique to get the muscles in that area a little bit prepped, and then the specific chiropractic adjustment to take that tension out of the system. So first give a little assessment to find out exactly where that restriction is and where that muscle tension is hiding. And for him, it's up here on the top right at the base of the skull, where it meets the neck. The first vertebrae there and the second one. First bone and second bone in the neck. Our first movement here is just to try to get some pliability and flexibility back into that area. I want him to breathe as well, to signal to his body that his body is in a safe environment and it doesn't have to be stressed. Fight or flight mode can relax, and to rest and digest. Parasympathetic. Now that area is a little more prepped and ready, and get that area adjusted. Opened up very nicely. Great release, and then I check again, and that tension is out of there. Much more relaxed. Muscles are soft. The movement's back in that area. Really quick change. Glad you got an opportunity to see what a typical treatment is like here for somebody who wants to get back to living their life without limitation. If you've been dealing with some type of pain or health issue and you've been looking for answers, maybe you're frustrated, maybe you've tried a lot of different things, I'm here to tell you you don't just have to keep living with it and suffering. See, we've found an extremely effective combination for helping people get back to living the life that they want to live and improving their quality of life. We combine our in-office treatment with our at-home treatment. In office, we do high-level chiropractic treatment combined with muscle stretching and soft tissue work. Out of office, we provide you with therapy exercises so that you can get back to living your best life without any limitation. If you're looking to get to the root cause of why you're having that health issue and limitation, I've got an amazing opportunity. It's the biggest discount that we've offered for any new patient to come in and get some help. I hope you'll click the link below so that you can get back to living your life on your terms, and I hope I'll see you soon.